Hi, this screencast is just designed to give you a little bit of a background on the policy and the evidence base for communication skills. So as you go through listening to this, I want you to think a little bit about keywords that appear that you think are going to relate to your communication skills. So thinking about how having good communication skills will help you to be a good dietitian. And we're briefly going to discuss all of this at the beginning of the session. So let's have a brief look at some of the policy and guidance that enforces the need for good communication in healthcare and in that working environment. And you'll notice that it includes communication with patients, carers, and other healthcare workers. So it's in all aspects of that you do in that environment. This is only going to be a very brief overview. There's lots more documents that you could look at, but you will have some references at the end of the session that are going to give you a bit of guidance on where to look for more. They're all long documents, so I'm just picking out key bits. No decision without me, about me without me, comes from liberating the NHS. Greater choice, greater control for patients. And that's back in 2012. And as you go through, you're going to see a lot of the same kind of statements across different documents, whether it's from the NICE guidance or from NHS, Department of Health. They're all pretty much similar terms that you're going to see. So this is looking at the essence of care benchmarks for communication, which is quite old now. It's 12, 13 years old. But the principles have not changed. Those guides are still very much current and relevant. And it's saying that all staff need to demonstrate effective interpersonal skills. All staff communicate fully and effectively with each other. And people and carers are enabled to communicate their individual needs and preferences at all time. So your communication's not just about you telling someone what to do or giving your opinion. It's about facilitating others to communicate as well. If we look at the NICE guidance on behaviour change, this has been reviewed, but no new evidence was found to make it worth changing the guidance. So it is still current. And it's very much about tailoring interventions to meet the individual person's needs, ensuring that you as practitioners are trained to adopt a person-centred approach when assessing people's needs and planning and developing interventions for them. So you're not just saying, oh, this will be really good. This is the best thing to do for your diet. You're saying, how does that work with you? How is that going to work with you as an individual in your personal setting? Communicating effectively, so we need to be making sure the information that we do give is really clear and understandable by the people we're working with. And we're going to be using reflective listening, which we'll talk a bit about later, and knowing how to demonstrate empathy. Again, we'll talk more about that later. And we have to develop rapport with our patients and service users and develop a relationship with them. So all of these things are going to be really important in your practice. More recently, we've had the NHS Health Education England person-centred approach framework. And I think this is probably one of the most important things to get a grip of. And the key message here is that patients and the public should be actively involved in all their decisions and treatments, and that includes dietetic treatment. They're offered informed choices. So which is the best option here? What is the doing nothing option? What is the dietary change option? How's that going to affect that person? And core of person-centred approaches. So it's real major focus on person-centredness, our communication skills, relationship building skills, and the conversations that we have that are trying to engage and enable people. So this is really important document to keep in mind. So let's have a look a bit about the dietetic specific things. So the comments we've got here, this bit of text, is from the Health and Care Professions Council, standards of proficiency. Again, these are the most up-to-date ones, even though they're now 10 years old. So they set out the standards. This is what, as a graduate, so not now in year one, but by the time you graduate, you should be able to do. And all graduates have to be able to demonstrate them. And it's about effective communication. That's verbal, non-verbal communication with a diverse range of people, not just people you like or people you can relate to, but all the individuals, groups and communities you come across. So you've got to develop that understanding of how your communication is going to impact on your service users and how you might need to modify that. Take responsibility for you being the one to change your communication to work for the individual that you're or group that you're working with. So there's a great need for us to be flexible in how we communicate with people. That's going to be a really important thing. So therefore, we've got to have that awareness, this person's a different age to me, or maybe from a different cultural background, different ethnicity, different gender, different socioeconomic status, or perhaps different belief systems. So we've got to use our skills to connect with people, however different they might be to us. And always trying to engage people to try and get them actively participating in their care. The reason for that is because the more we do that, the better the chances are they're actually going to make change. And that's what we really need people to do. So this comes from the BDA curriculum framework. This is the most recent one of those. And what does it say about dietetics? You've got to develop dietitians who are competent, but also compassionate, looking at people holistically, offering person-centered care and support. So this whole idea of looking at the person we're working with very holistically, not just as a condition, not just as a diabetic or a celiac. It's a person who's living with diabetes or living with celiac disease. And what characteristics do we know about that person? And we've got to be able to translate our nutritional guidance. So you'll be learning all sorts of different nutritional guidance for different conditions. But how's that going to work for that person? And how are we going to work to empower that person or those people to make informed choices? And you'll see here we've got a range of methods of styles of communication. Active listening, which is going to be our starting point in the session today. We facilitate people, we build this rapport, and we interpret what's going on non-verbally. We're watching, we're taking interest in what's happening. And we'll be looking at behaviour change techniques. And I know you've got a module that you'll be doing on behaviour change later on. So we're looking at what facilitates behaviour change, what barriers are there to behaviour change, and how can we work with those. So all of these things are said to be important, not just national policy, but the Health and Care Professions Council and the British Dietetic Association. And this is our code of conduct. And I really like this. I didn't really study this until quite recently, but this is saying what we will do. So we are going to respect our individuals, their needs, values, culture, etc. We're going to respect that individual's right to make an informed choice. And that choice might be not following your advice. So we've got to be mindful of that. Not everyone's going to do what we hope they would do, or what we think would be in their best interest health-wise. We've got to treat everybody that we come across with compassion, empathy, fairness, honesty, courtesy, etc., and communicate appropriately. Service users and colleagues. So very similar messages, which isn't greatly surprising. But this is relevant for student dietitians, qualified dietitians, and dietetic support workers of all levels. Service users could be patients or clients. It all means the same thing. But what I really like about this, it says it's required that all members, including students, follow this code. They have an obligation to adhere to the standards within the code. It's not optional. So your communication skills development is not something that you're going to maybe do. It is something that you most definitely have to do. And it's going to make you better at your job and give you better job satisfaction as well, because you're going to be more effective. So let's just have a brief look at one or two aspects of evidence. And there is so much of this around. This is just a real snapshot. So what have we got? A little bit of evidence here that I'm just giving you an idea of. And these first two papers I'm mentioning are about patients' views. So these studies have interviewed patients and asked them about their experiences and what it is about dietetic consultations they liked or didn't like. So they're providing really good insight. And in two different countries, Hancock is UK and De Welt and Gesser-Elderberg is actually in Israel. There's a similar one or two in Australia and Canada as well. And what they're saying is that the patients are saying, we want good communication. We want to build a relationship, a trust relationship with that dietitian, but we want individualized care. And one of the really important aspects of that is that being patient-centered can mean that it's patient-led. So you're giving the patient is taking control and, taking a real lead in the consultation. But sometimes people don't want that. So sometimes they want more practitioner-led. So they want to be given more information. So our skill set is to become flexible practitioners so that we can work with what the person actually wants. So it can go backwards and forwards. So sometimes people say, oh no, you just tell me what to do. But as you start working with them, they will go, oh, hang on a minute, can I ask about this? And they will become more engaged if you're communicating well. We've also got quite a lot of evidence of what goes wrong if communication isn't good. And although this paper is quite old, it's a really good example of a study that's looked at the patient and the professional perceptions. What actually happened in that consultation. And what is really interesting from that is that the patients have gone away with a different understanding of what they were being advised to do, where there is little empathy. So if the dietitian is not actually demonstrating empathy for that patient, they're not taking it in, they're not taking as much information. So they're going away with a different agenda. Well, that's going to make a lot of difference to the clinical outcomes because they're not going to be following the advice that you think you've given them. And that's not going to be good for their motivation. It's not going to be good for their health. So we need to really be mindful of that. And, if we don't build rapport, people aren't as likely to tell us what really matters, how they're feeling about things, what they're worried about, their concerns. And all the time, if you're not getting a chance to voice your concerns, they're in the back of your mind. So people aren't focusing on what you're talking about. They are very much in the mindset of, I'm still thinking about this, I'm still worrying about this. And the Stewart paper is, about satisfaction. People are much less satisfied if they haven't had good communication with us. It's really important that patients leave with clear and accurate understanding of what they're meant to do. And just think, what could happen if there's disagreement? Think that through. If patients aren't going to voice their concerns, what's going to happen? And what happens when they're not satisfied? So just spend a little bit of time before we have the session and thinking about what these questions really mean in practice. If someone's not satisfied with the consultation they've had, you may be able to relate it to some personal experiences yourself. What are they going to do? What's the impact of that? And we'll continue to unpack that a little bit at the beginning of the session when we meet.